With new cases of COVID-19 continuing to drop across the state and vaccines now being offered to anyone 16 years of age and older, what does the future look like for Utah? I'm joined by Dr. Petronella Adamako, an infectious disease physician at Intermountain Healthcare's McGady Hospital, that's in Ogden, with an update on the pandemic here in Utah. Doctor, thanks for taking the time to join us. You know, over the weekend, Utah's mask mandate was lifted. What sort of effects will that have on our communities?
Well, thank you for having me. It's too early to tell, but we certainly do not have the disease under control as yet. So we are hoping, though, that though the mandate has been lifted, we really do encourage people to still continue wearing the masks, keeping their social distancing, and practicing good hand hygiene.
And I know it's only been...
Sorry.
Oh, you're fine. I know it's been just a few days, but over the weekend, I certainly noticed as I was out and about, a lot of Utahns continuing to wear their mask. It's almost habitual at this point, I would say. Wouldn't you agree?
I completely agree with you. Even though we've been vaccinated, we are still pushing it because, again, we still do not have it under control. So, yes, we are encouraging people to continue wearing the mask.
What are the impacts of the new COVID variants being seen here in the state of Utah?
We are still learning more about these variants as we go along. We do know that I think we have plateaued a little bit. We have been around 7% test positivity rate for a few weeks now. We've been kind of hoping that the numbers would go down, but I do believe that we are seeing a number of variants or new cases being the variants in our state. So we still do not have things under control. In terms of the variants, I mean, what do we know about them? We are learning more as we go along. Do they spread easily? Are the vaccines effective against them? Do they cause more severe disease or milder disease? There's still things that we are learning about.
And doctor, what about the efficacy of the vaccine? Thank goodness we have the vaccine, and the rollout has been very successful so far.
That is good. Yeah, I mean, that is true. I believe the Utah state has been doing a great job. In terms of the efficacy, I mean, in terms of the original variant or the original virus, we know the data out there. Pfizer was 95%, Moderna 90%, and co. In terms of the efficacy against the newer variants, we are learning more as we go along. We have the B.1.1.7 from UK, and it appears that the Pfizer vaccine is still effective against that one, greater than 90%, about 91%, I believe. There's the South African variant, which does not appear to be, or let's say it breaks through with the Pfizer vaccine. The thought was that the Pfizer vaccine would be effective against it, but a report came out from Israel recently that there was breakthrough with the South African variant with the Pfizer vaccine. So the South African variant appears to be a little bit more resistant to our vaccines. So we just see how things go. But we do expect the vaccine companies to be adjusting the vaccines to make up or to account for these variants as well, so that hopefully down the road, the vaccine should be effective against these variants.
Dr. Adamako, what else would you say to Utahns right now, where we are currently in the pandemic?
We are certainly higher during the winter, and we have come down, so that's great news. I mean, we're moving in the right direction, but we are not at our goal as yet. So I would encourage all Utahns, please get vaccinated. Well, since everybody's everybody can get the vaccine now, I would encourage everyone to get vaccinated. I would still say that till we know more, till we get our numbers under control, please continue to wear your mask. Please stay home when you're ill. Please practice good hand hygiene, and please practice social distancing.
We appreciate the advice. Dr. Petronella Adamako, thank you so much with Intermountain Healthcare. If you'd like more on COVID and the vaccine, go to our website, fox13now.com.
Thank you for having me.